Hi there. Today we'll talk about the assessment and management of patients with male reproductive disorders. So this includes conditions that affect both reproduction, sexuality, and urinary elimination of males. Patients may experience anxiety and embarrassment. It is important to be sensitive to cultural and emotional issues related to sexuality and the genitals to accomplish effective assessment and communication. Provide for privacy and have an openness to discuss critical and sensitive issues in education. Nurses must be comfortable when examining the male genitalia. Recognize own attitude and perceptions regarding the male reproductive disorders. Several organs serve both urinary tract and male reproductive system. Diseases are treated by a urologist. External organs include the testes, epididymis, scrotum, and the penis. The internal organs include the vas deferens, ejaculatory duct, seminal vesicles, prostate gland that produces a fluid that nourishes and protects the sperm, and Cooper glands, the bulbourethral glands, located inferior to the prostate gland. It empties its secretions into the urethra during ejaculation, providing lubrication. Male sexuality is a complex phenomenon that is strongly influenced by personal, cultural, religious, and social factors. An assessment of the male urinary function and system is done by asking about the usual state of health and recent change in general physical and sexual activity. Symptoms related to urinary obstruction are explored, which could be the result of an enlarged prostate. Increased urinary frequency, decreased force of stream, double or triple voiding. That means the patient needs to void 2 or 3 times over a period of several minutes to completely empty the bladder. Nocturia, needing to get up to urinate in the middle of the sleep at night. Dysuria, which is painful urination. Hematuria, blood in the urine. And hematospermia, which is blood in the ejaculate. Assessment related to the history of other medical conditions that may affect sexual function, like diabetes, cardiac disease, multiple sclerosis, stress, alcohol, medications, and smoking history is also taken. Gerontological changes need to be considered. Decreased muscle strength and sexual energy resulting in changes to sexual response, prolonged time to reach full erection, rapid penile detumescence, and prolonged refractory period and the decrease in the number of sperms, enlargement of prostate gland, decreased sex hormones, especially testosterone. Diagnostic tests. Digital rectal examination, or DRE, is used as a screening tool for prostate enlargement and prostate cancer. This is recommended annually for men above 50 years. 45 years if African Americans or have family history of prostate cancer in the first degree relative. After explaining the procedure, the provider, that is the physician, PA or NP, places a well-lubricated gloved finger in the rectum to assess the size, symmetry, shape, and consistency of the prostate gland. Tenderness of the prostate gland on palpation and the presence and consistency of any nodules is also assessed during a DRE. The position is leaning over the examination table or side lying with legs flexed towards the abdomen or supine with legs in the stirrups. Instruct patient to take deep breaths and exhale slowly to relax the anal sphincter and minimize discomfort during the procedure. Turning the feet inward so his toes are touching further helps complete this important screening tool. The normal finding is that the prostate will be round with palpable median sulcus or groove separating the lateral lobes. Should feel rubbery, free of nodules or masses. Next is testicular examination. This is recommended to start during adolescence once a month after a warm bath or shower. He uses both hands to palpate the test. The patient uses both hands to palpate the testes. Normal testes is smooth and uniform in consistency and feels like a boiled egg. Feel for small lumps or abnormality. If any small pea-like lump or if the testis is swollen, consult primary provider. Next is PSA test. The PSA test along with the DRE is recommended as screening test for prostate cancer. It is also used to monitor patients from recurrence after treatment for cancer of the prostate. This blood test measures the PSA, which is the protein produced by the prostate. It is elevated with BPH, acute urinary retention, acute prostatitis, and prostate cancer. Activities that may stimulate the release of prostate fluid and therefore might give a false positive or a high value is avoided for at least 48 hours before the blood test. Some of the activities include intercourse, ejaculation, vigorous exercise, catheterization, digital rectal examination, and prostate biopsy up to 6 months. TRUS is transrectal ultrasound. This is performed in patients with abnormalities detected in the digital rectal examination and elevated PSA levels. A lubricated condom covered rectal probe transducer is inserted into the rectum. Water may be introduced into the condom to help transmit the sound waves to the prostate. Prostate fluid or tissue may be obtained for culture. A biopsy is performed at the time of prostatectomy. Nocturnal penile tumescence. This is a test done in a sleep laboratory to monitor changes in penile circumference during sleep to assess male sexual function. Nocturnal erections occur in healthy males of all ages. The first disorder is erectile dysfunction, or in other words, impotence. It is the inability to attain and maintain an erection sufficient to perform satisfactory sexual intercourse. The causes are both psychogenic and organic. Psychogenic causes include anxiety, fatigue, depression, absence of desire, and privacy, as well as trust and relationship issues. Organic causes include cardiovascular disease, endocrine, example, diabetes, pituitary tumors, testosterone deficiency, hypo and hyperthyroidism, hematological conditions like Hodgkin's lymphoma and leukemia, and neurological disorders like Parkinson's disease, spinal cord injury, and multiple sclerosis. Trauma to the pelvic or genital area, alcohol or alcoholism, medications like antihypertensives, including hydralazine, metoprolol, nifedipine, antidepressants like amitriptyline or Elavil, antifungal medications like ketoconazole, antihistamines like diphenhydramine or Benadryl, prostate cancer treatment drug or leuprolide or Lupron, antipsychotic medications like haloperidol and anxiolytic like lorazepam, chemotherapeutic drugs, diuretics like furosemide and spironolactone, NSAIDs including naproxen and indomethacin, Parkinson meds, example levodopa, benztropine or cogentin, etc., and drug abuse. Diagnosis include sexual and medical and social history, presenting symptoms, blood test, nocturnal penile tumescence test, and a psychological evaluation. Medical management for erectile dysfunction. Pharmacological therapy typically used is phosphodiesterase type 5 inhibitors or DPE5. The common ones are sildenafil or Viagra and tadalafil or Cialis. Sildenafil is taken 30 minutes before intercourse. Tadalafil must be taken just before the sexual activity. The effect peaks at 30 minutes to 6 hours, but may last up to 36 hours for Cialis. These drugs must not be used more than once a day. There must be sexual stimulation to produce an erection. Side effects include headache, flushing, dyspepsia, abnormal vision, and nasal congestion. It is contraindicated with nitrates or nitroglycerin, and this can cause severe hypotension if used together. Mechanical devices include penile implants and transplants and negative pressure devices to help with erectile dysfunction. Client education must include teaching about the medication, safe use, side effects, contraindications, proper use of mechanical devices, discuss the cause of sexual dysfunction that can be controlled, including smoking, drug abuse, and alcohol abuse. Provide list of support services for client and sexual partner, and discussion of alternate sexual practices. BPH or benign prostatic hyperplasia. Benign prostatic hyperplasia or BPH is non-cancerous enlargement of the prostate. It is the most common disease in aging men. It typically occurs among men older than 40 years. By 60 years of age, about 50% of men have BPH and 90% of men have upon reaching 85 years. Risk factors include smoking, heavy alcoholism, obesity, reduced activity, hypertension, heart disease, diabetes mellitus, and a Western diet, which is high in animal fat and protein, refined carbohydrates, and low fiber. BPH develops over a prolonged period of time. The enlarging prostate causes compression on the urethra, causing partial or complete obstruction to the flow of urine, and symptoms depends on the severity of the obstruction of urine. Diagnosis is by history and physicals, DRE, PSA levels, cystoscopy, and ultrasound. Clinical manifestations. Many men have no symptoms, and the onset is usually gradual. Urinary frequency, urgency, nocturia, hesitancy in starting urination, abdominal straining with urination, decrease and intermittent force of stream and sensation of incomplete bladder emptying, decrease in the volume and force of the urinary system and post-void dribbling is usually seen among these patients. Signs and symptoms of complications include urinary retention, UTI, pyelonephritis, sepsis, calculi, and renal failure. Generalized signs and symptoms like fatigue, anorexia, nausea, vomiting, and pelvic discomfort is also seen. Management of BPH. The goals of medical management of BPH are to improve quality of life, improve urine flow, relieve obstruction, prevent disease progression, and minimize complications. The treatment depends on the severity of the obstruction, severity of the symptoms, and the causative factors. The most common treatment with the mild symptoms are watchful waiting and lifestyle changes. Catheterization is sometimes done to relieve the obstruction, and if there is difficulty to void. Cystostomy is done to promote urinary drainage. Avoid over-the-counter drugs that causes urinary retention, such as anticholinergics, oxybutynin and amitriptyline, antihistamines like diphenhydramine, decongestants like pseudoephedrine, Sudafed, opioids, benzos, and NSAIDs. Medical treatment include alpha-adrenergic blockers like terazosin, tamsulosin, and doxazosin, which helps relaxation of the smooth muscles and therefore improves the urine flow and relieves symptoms of BPH. The main side effects of postural hypotension, dizziness, headache, and rhinitis. So blood pressure is checked before administering this medication. 5-alpha reductase inhibitors, example finasteride, dutasteride, finasteride and dutasteride is used. It decreases the prostate size. The side effect again includes hypotension, decreased libido, ejaculatory dysfunction, flushing, and gynecomastia. Most male health disorder medications that are used have the side effect of hypotension, and therefore the nurse must check the blood pressure before administering this medication. Alternative therapies include dietary supplements. Serranoa repens or saw palmetto berry is commonly used in many cultures. It is not approved by the FDA and therefore must not be advised to patients. Surgical treatment include TURP, which is transurethral resection of the prostate.